Hi, my name is Dr. Jeff Frost. I own AZ Regenerative Medicine. Today I have Leanne here. Leanne's going to tell her story. Leanne, take a big breath. Okay, because this is a little nervous sometimes being recorded, and we just want you to hear a conversation of where she came from, what she did, and then how she's doing today. So Leanne, tell me, before you came to me, what was your pain like and when did it start?
It came on very suddenly the day of Christmas Day.
Okay.
And it was my first experience with any kind of pain in my back, and it turned out.
So you'd never had it before, just
never had it before.
Wow.
And it came on very suddenly, and at first I thought it was just muscular, something muscular, but
Yeah.
then by the next day I couldn't walk, I couldn't stand up straight.
So like in the morning when you woke up,
Yeah, I went.
you couldn't like get out of bed or.
Oh well, I could if I bent over, like hunched over, I could walk, but I couldn't stand up straight. Yeah.
And it, just like that.
Just like that, it hit me.
Wow. What did you do after that? Christmas Day, you can hardly walk. What did you do about that?
Well, it was Christmas, so I managed to get some sleep, not a lot, because I couldn't get comfortable.
Okay.
But the next day, my husband took me to urgent care. And urgent care recommended I go see my primary care person. So
That sounds common.
I did that the next week as soon as I could get in, and she recommended.
So it took you a whole week to get into the medical doctor.
Not a whole week. This was Thursday, was the 26th, and then
And it was
I
Christmas
saw
time.
her
Yeah.
and I saw her on Monday the 26th, I think it was.
Okay.
Or no, it wasn't the 26th. It was that following Monday.
Okay.
Yeah.
So with that being said, when you went to the medical doctor, what did the medical doctor do?
She did a preliminary exam on me, and I told her what happened, and she says it's probably sciatica.
So what you were telling me was you went to urgent care. Urgent care sent you to your primary care.
Mm-hmm.
You got in a few days later, was the following Monday.
Mm-hmm.
And then the medical doctor sent you out. They referred you someplace. They refer you for like MRI, X-rays. What did they refer you for? Imaging?
Right. She gave me an order for both an MRI and an X-ray to see what was going on in there.
And when did you see me in reference to the medical versus coming to see me?
Well, after I got these orders from her, I had to actually, I had to schedule them.
Right.
And so it took another week to get in, almost a week to get in to have those done.
Right.
So I had those done on, I believe it was a Thursday, and then it was the following day, I believe it was Friday the 9th, I think it was, that I came in to see you for the first time.
What I'm hearing you tell me is on the 25th you were in pain, and you didn't get to see me until the 9th because you had to go through seeing the urgent care, seeing the medical doctor, getting the MRI and the X-rays done before you could even come see me.
Well, I probably could have come see you earlier,
Right.
but while I was waiting to get these tests done is when I discovered you.
Okay. How'd you discover us?
It was basically Facebook. I was just scrolling and happened to run across your video on Facebook, and I was searching for a good doctor to go to because I didn't want to just go to anybody just because I was in pain.
Well, why did you pick our clinic? I mean, there's so many other doctors you could have gone to.
Right, but I realized after I watched your video and I referenced you and things like that, I researched you is what I'm trying to say.
Right.
Is I realized that you are a different sort of doctor in the way that you treat patients, because you don't only do chiropractic. You do many other things to help your patients as well.
We do, 100%. So we do like regenerative therapy, we deal trigger point injections. So we have a medical staff here that helps on the chiropractic and the physical therapy side. So for you, when you came in for a consult and examination. I think there was a special at that time, right? For like $49 instead of $287 or $85 or something like that.
Yes.
Yeah, so that made it financially easy to come in.
And that's another reason I came.
Okay.
Because I thought that would be well worth it.
And we did the consult and the exam on that day when you left. How did you feel about being here?
I felt wonderful. In fact, one thing that occurred is I remember your Facebook ad, you said we can set up a phone conversation for, like a 15-minute phone conversation just to find out, and you were interested in finding out if you were going to be able to truly help me.
If this was the right place for you.
Right.
Yeah. And I don't want to waste my time. I don't want to waste my patient's time. And so we did the consult.
Right. And so I called you. I scheduled that. I had that on that Wednesday.
Was there any charge for that?
No charge for that. And after I talked to you on the phone, and you said it sounds like I'd be able to help you. And so that's when I made the appointment to come in. And we made it on Friday because I told you I was going for my imaging on Thursday.
Okay.
You said that's good. Because,
so my staff was able to work around that and make that work for you.
Yes. And then, so I did go for my imaging on Thursday, and fortunately I was able to get some, a DVD of the, or CD or whatever it is.
Right.
Of the images. So you said, go ahead and bring those. And I said, okay. So I did that on that Friday.
Got it.
Mm-hmm.
With that being said, we discussed a treatment program.
Right.
Mm-hmm. And one of the requirements I have is, and you passed the test, was, are you willing to do the work at home?
Mm-hmm.
Because what we do in here was we literally physically make changes. But without you doing that, I explained to you that we can't fix you.
Right.
And that's one of the reasons I took you on as a patient. So while you're interviewing me, I'm interviewing you because I want to be successful and I want you to be successful.
Right.
So the fact that you were willing to put the work in was one of the biggest reasons that I knew I could fix you.
Well, thank you.
Yeah. No, you did the work. And so I appreciate you, stepping up. And tell me, after we began the program, how long did it take before you actually felt like you were 100% where you could at least get through a day and not feel a lot of pain?
Almost immediately after my first treatment.
Okay. And then we gave you equipment to do at home, and you did the stuff on the equipment, right?
Yes.
Right. And then, with that being said, what do you expect your future to look like as far as enjoying your activities?
Well, I am by trade. I'm a geologist, and I love to get out there and hike.
Okay.
And with the hills around here, they're kind of challenging sometimes. And so I really miss being able to do that. And I wasn't doing a whole lot of it before because I was working.
Right.
But I would really like to get back to my outdoor activities and looking for rocks and things like that. So that's my main goal, is to get to the point where I can do my hiking again.
So that's one of the most important things, folks. We have to find out what your goals are. We need to make sure that you're on board and you're willing to partner with us and make this happen, because I can't do it without you. Our clinic is not one where you just come in, you passively get cared for, and your life turns around for the rest of your life. What we end up doing is we end up teaching you how to keep yourself healthy throughout the rest of your life after we've corrected the problem by getting to the cause of it. So if you're one of those folks, like Leanne, or similar problems, whether it's knee, hip, shoulder, back, sciatica, we would love to have you give us a call. 602-992-2656 to either set up a phone consult at no charge, or come on in and let me get my hands on you. Let me see clinically what's going on and explain to you the cause of the problem and find the right solution. Have a beautiful day. God bless.